Derek Phillips, I'm glad that you've been able to rejoin us. Good. So talk about your life as number 12.
Well, it's good being number 12, for sure, for sure. So I am a prescribing psychologist in downstate Illinois, about 3 hours due south of here in a public hospital. And I wanted to share about a patient recently that I was actually seeing not for medication because it was outside of my age limit. Which we hope will no longer be a limit in the near future. But I was seeing her actually for cognitive impairment. I'm a neuropsychologist first by training, and the patient came in and was having a fairly medically complex patient, and she was describing Parkinsonian symptoms and had really been deteriorating over the past few months. And when I went over the medications, just looking at the list and, talking through, because they were seeing someone outside of my system, so I didn't have it all at my fingertips. I saw, it was very clear that medications were definitely a problem for her. She was on 2 different antipsychotics at the same time. And when I asked her, so why are you taking these? Well, one's for sleep and one is for these hallucinations that I've been having. But still on 2 antipsychotics that, we know are still doing the same thing. And she was also on a benzodiazepine and an antidepressant, and also on one more that I'm having trouble remembering at the moment. But it was very clear that it was very likely that some of the problems that she was having were from that kind of mix of 5 different medications that she was on. But since she was outside of the age range that I can treat or can even tell you need to stop taking these, I referred her to our integrated behavioral health program, who is run by a psychiatrist that also happens to be my collaborating physician. And so talked to him about it, and he said, I'm so glad you caught this. It was someone that was coming into our system, was being treated by someone else. And so he's been able to follow her. And he himself has been, titrating her down and stopping some of those medications. And she has essentially had a 180-degree turn for the better. She's in her 70s, had been very independent, but was not. And she has now returned to full independence. And he has, which is really kind of surprised me a bit, is he's really made an effort to tell other people, man, Derek made a great catch here. And so that just speaks to our training and how we really do make a difference. This isn't just us talking about making a difference. We actually do make a difference. We're another set of eyes. We spend a lot of time with our patients. And so I think this is just one very visible way that one patient was able to benefit from that. And if it is only one, that's enough. But we know it's not only one. It's a lot. So thank you for listening. I know I'm preaching to the choir here about the benefits, but it's really changed my life in a lot of ways. Obviously professionally, but also personally as well. And it's really just my pleasure. This has always been my dream job. I'm doing my dream job. So thank you.
And I want to thank you too, because you've now allowed another of our psychologists, Karen Foast, to be able to train at Sarah Bush Lincoln, which is fantastic.
Yes, in fact, she will be starting next week with her family medicine rotation within the system that I work in downstate Illinois. So yes, we're very happy about that, and we're working toward that goal of the 1,500 in 20 years. So we've got to get busy.
Yep.
So
yes, we do. Thank you. Thanks so much, Derek.